Hi, this is Terri Coutee. I'd like to welcome you to the DIEP C Foundation educational channel, where we talk about all topics and options related to breast reconstruction. Today, I'm very happy to welcome my guest, Dr. Minas Chrysopoulo from PRMA in San Antonio, Texas. Welcome, Dr. C.
Hi, Terri. Good to see you,
Good
as always.
Good to see you too. Dr. Chrysopoulo is a board-certified plastic surgeon who specializes in microsurgery and a number of different breast surgeries as they relate to breast cancer for patients. He sees women from all over the United States, in fact, all over the world. It's one of the highest volume breast reconstruction centers in the country. Dr. C is also the founder and developer of the Breast Advocate app, which is a free app for breast cancer patients who are beginning their journey or deciding on their treatment options. So we are very happy to have you today.
Thanks, Terri.
After getting that mouthful of introduction done, we really appreciate what you do for the breast cancer community and the breast reconstruction community.
Likewise. DIEP C, doing amazing things. Congratulations.
Thank you very much. I really view this as a team effort.
Yeah.
And so I've often told some of the surgeons that I interview, you being one, we truly appreciate you being on our closed Facebook group. Not only that, but helping me to promote education, which is the mission of the foundation. So thank you.
Yeah, you're welcome. Anytime. It's all good stuff. It's our pleasure. You've got some really great surgeons involved, great people. It's lovely to see everything being done really in the right way, evidence-based, exchange of ideas in a way, in a forum that patients have access to. It's great, really great. So kudos.
Thank you very much. Thank you very much. Well, we like to listen to patients, and I like to bring questions on board to ask all of you to help us sort through all this information and get it gathered on the YouTube channel. They love watching these. So the question today, Dr. C, that I get frequently, patients will ask, what do you mean phase 1 and phase 2 of surgery? What are you talking about? I'm going to let you roll with that because patients need to know breast reconstruction is often more than one surgery. So take it away.
Yeah, so breast reconstruction should really be viewed as a process rather than as one procedure because, as you rightly said, for most people, it's going to take more than one surgery to get the best results. You can certainly have all the breast reconstruction procedures performed in one stage. So typically it's at the same time as the mastectomy. That's preferable. And we do it at the same time as a mastectomy in as many cases as possible. Sometimes because of the diagnosis, the stage of the cancer, because of other stuff going on, even an access issue. A lot of patients have problems still in this day and age to accessing specialists that offer the procedures they want. But anyway, if we can do what's called immediate reconstruction, which is at the same time as the mastectomy, the results are better because there's less scarring and results are just more natural. Now, immediate reconstruction doesn't mean that all the breast reconstruction is finished at the same time as the mastectomy. It just means that the reconstructive process is started at the same time as the mastectomy. There are cases in which you can finish a breast reconstruction all in one go. So some surgeons will feel that in a specific situation, they can give you, the patient, the final result, and there's a really good chance that you're going to look really good. Mm-hmm. So there's a big push for direct to implant reconstruction, for example. So in the right candidate, if you have a very high quality mastectomy, you can get a lovely result in one stage with direct to implant reconstruction. But many, many things need to be right for that to happen. So patients need to pick not just their plastic surgeon, but their breast reconstruction team, which really they should include the breast surgeon in that decision, because breast surgeons and plastic surgeons who work together on a regular basis, they have understanding between them, they know each other's preferences. Outcomes are going to be better if you have an experienced team approach. If you don't have good understanding between the breast surgeon and the plastic surgeon can only do so much if the quality of the mastectomy isn't good enough. So, because oftentimes the mastectomy results aren't completely predictable, and we have contour issues, little unevenness in the tissue that's left behind, it's very common to have little contour defects. And so a secondary revision surgery in the vast majority of people can make things better. It can address contour defects with fat injections, fat grafting, for example. It can make the breasts more symmetric. Whether you have an implant-based reconstruction with tissue expanders or direct to implant, or whether you have a flap reconstruction, it doesn't matter. In many, or I would say in most situations, the patients should view the first surgery as the surgery that makes them physically whole, and the second surgery as the opportunity to make them look as good as possible cosmetically. So that's the approach in our practice. We do perform one-stage reconstructions, but you've got to have everything right.
Lined up.
Everything has to be lined up and everything has to come together. And I have to say, it's a rare event where you have a patient after the first surgery and you don't think you can make them better in terms of the final result. So I don't want patients to feel that you absolutely must have a two-stage reconstruction for the best result. I'm just saying that if you're looking for the best results, you have to be prepared for sure for more than one surgery. And some patients end up needing more than two procedures too. It depends on what they've got going on, the nature of their disease, the mastectomy, lots of individual factors. But take-home message, irrespective of the type of reconstruction you're looking for, be prepared for more than one surgery for the absolute best results.
I think that is a perfect word to use, be prepared.
Yeah.
And I think there's, because so many times I hear women, what are you talking about, phase one and phase two? Phase one, as you said, is the reconstructive part where your breasts are restored. Phase two is the fine tuning. What I'd like to add, Dr. C, so that was a really great explanation of the fact that really reconstruction involves more than one surgery. But what I'd like to add as a patient who has been through this, I always tell patients after phase one, particularly I think in a setting of DIEP flap or a flap surgery, in my case I had delayed DIEP, be patient. Be patient after phase one. That fine tuning or phase two, it really has been described as the icing on the cake. And it really is. You're in such a healing process after phase one that to look at your breast, you have to realize those very topics you talked about, some of those anomalies, divots, little inconsistencies, that's what's taken care of in the second phase. So you gave a really great explanation on that today, and I do appreciate you sorting that all out for us.
And I know, I don't want patients to feel that just because they weren't offered, phase two, it doesn't mean their surgeon didn't care or anything like that. They may just have a really good result, and the surgeon doesn't feel they can be, any better. They can't make them any better in their hands. I don't know. It's a very individual thing. So, and specifically about DIEP flaps, let's talk about that for a sec, because it's a great example to highlight the two different stages. So you can do DIEP flap reconstruction and finish the reconstructive process all in one go. So some surgeons do that. In our practice, we're very much focused on minimizing complications after the first surgery. So to really, if you're looking at holistic results, so yes, obviously you want a beautiful breast reconstruction, but you can't forget about the abdomen, you can't forget about the belly. And so to do an aggressive abdominal contouring, the kind of thing that's involved at the same time as an abdominal cosmetic procedure like a tummy tuck. Mm-hmm. For us to do DIEP flap surgery and then to do aggressive cosmetic touches at the same time, it can increase the risk of wound healing problems and complications. So for us, we feel, at PRMA, let's just prioritize healing at stage 1. Let's make the patient whole. Let's get them home, healed, and with a successful reconstruction. And let's focus on what we need in place at stage 1 to allow us to maximize the cosmetic results later. But let's focus, the abdominal recontouring, the scar revisions, the liposuction, all that stuff. Nipple reconstruction, we tend to leave until stage 2. All those things we leave for the second surgery when we can be more aggressive from a cosmetic standpoint. Mm-hmm. But to be clear, there are surgeons that feel that, they can do enough of that at stage 1 and try and get things done in one stage. So it's very much, patients need to know, they need to align their expectations and what their goals are with, what their surgeons feel they can do. And that will determine whether they need 1 or 2 stages. But there's no, I really must stress for us anyway, we feel exactly as you said, that to really get the best cosmetic results consistently, the vast majority of patients are going to need more than 1 surgery.
Yeah. Well, thank you very much for joining us today and for sorting out the question about what is phase 1 and phase 2, or stage 1 and stage 2, sometimes more, of breast reconstruction. Appreciate your time today, Dr. C.
You're welcome.
Thanks for joining us on the DIEP C Foundation channel. If you have other topics you would like us to discuss, please let us know in the comments. Like and subscribe to our channel. We have more coming on board. Take care, Dr. C.
You too, Terri.
Bye.